Hello guys, I'm Dr. Claudia Kim. Today I'm going to be talking about gynecomastia, what it is, what kind of procedures we can do, and the recovery time after surgery. So what is gynecomastia? So it is an abnormal growth of benign breast tissue in men. Now it's super common, it's much more common than people think. Some statistics say it can be prevalent in up to 50% of men in their lifetime. Now what causes it? The causes of gynecomastia is most commonly due to hormonal imbalances during puberty. So when there is an abnormal balance of estrogen versus testosterone, you can have stimulation of the breast tissue in a male that causes enlargement of the chest. Now there are other causes that can potentially cause the breast tissue to expand, and that has been associated with certain types of medications, some blood pressure medications, some antipsychotic or psychiatric medications, some antibacterials, things like that have been associated with stimulation of the gland tissue and the breast tissue in a male that's beyond puberty. And other symptoms or other conditions such as thyroid abnormalities. The more commonly known one is the use of anabolic steroids. So if you're trying to bulk up for the gym and you're trying to get swole, it is going to potentially cause stimulation of the breast tissue in a male. Also with liver disease, excessive use of alcohol and marijuana have also been linked. So there are many causes of what can have the male chest expand, and we can talk about how to address it. The way that we categorize the type of gynecomastia is based on stage, which is the size of how much prominence or how much projection you have of the gland tissue and how much skin laxity. So grade 1 through 4. So obviously grade 1 is when you have minimal enlargement or protrusion of the chest, versus grade 4 where you have the most significant amount of projection or stretching out of the skin. And we do approach those different stages differently. Now for the gynecomastia that appears in adult or early adulthood or adolescence, a lot of the times it will resolve on its own. So that's why we don't consider doing surgical intervention for gynecomastia unless you're at least in your early 20s, so that we know that if it has gone away, then we don't have to address it and it might just go away on its own. Right? Now, there are other things that we definitely look for before we consider you as a good surgical candidate. And it's questions such as, do you have any pain? Do you have any nipple discharge? Do you feel any hard balls in the chest area? Or has it been getting bigger with time? Or if there's any history of breast cancer in the family. These are all key things that we need to look out for us to suspect to do additional workup, either like an ultrasound or a mammogram, just to make sure that it's nothing concerning or potentially cancerous. How do you tell if you have gynecomastia? So a lot of the times the more obvious cases, patients kind of know and they've always been a little bit insecure about it. But what if it is what's called pseudogynecomastia, which means that it's just fat cells, it's not gland cells? In those individuals, you can see fluctuation of the chest. So let's say you ended up losing a couple of pounds and you got quite lean and the chest got flat. Then it was just pseudogynecomastia where it's just fat. So you lost the fat, you got skinnier, and then the chest gets flatter. However, in people with true gynecomastia, even though they lost a significant amount of weight and their body fat percentage is on the lower side and they're super lean, but they still have the projection or like the fullness of the chest, then that's likely gynecomastia. Another little exercise that I do with my patients is that when you flex, and if you guys are gym rats, you do this in the mirror a lot, but you kind of engage your pectoral muscles and really kind of flex the chest muscles, and you can actually see the fullness or the gland tissue kind of pop out. So that's kind of my confirmatory test to see if you really do have true gynecomastia or not. But usually just based on the patient's history and what they tell me, how it presented, you can get a pretty generalized idea of whether you have it or not. For the procedure, whatever the cause of gynecomastia, we need to address. So usually you can tell that from the patient's history. And most commonly I'll ask, when did you first notice that you had a larger chest? And if you tell me that you've noticed it ever since you were young, then it's probably due to the hormonal imbalances during puberty. And so in that situation, we know that that's not really going to change. But if the cause is, let's say you were using a period of anabolic steroids, when you were trying to work on your physique, you have to make sure that you are not going to be using those medications that can potentially cause stimulation of the gland tissue again after we remove it. So we just have to make sure you have the best outcome to control the causes. The way that we perform the surgery, it depends again on the grade of gynecomastia. So normally or usually with grade 1 and 2, you can have a minimally invasive or lesser invasive procedure, and that involves usually liposuction of the chest, because for the chest area you have fatty tissue, and you also have glandular tissue. So depending on how your chest composition is, we'll combine it with liposuction. However, liposuction is only going to address the fat cells, right? You're still going to have the gland cells, which won't really get sucked up by the liposuction machine. So in that situation, we do have to make an incision, and the incision is around the areola. It's like a smiley face incision, which hides really, really well. And then you go inside and you scoop up the gland tissue and then we close. Okay, so these are for grade 1s and 2s. Now, grade 3 becomes a little bit grayer, because if you do have skin looseness, the liposuction and gland excision may or may not be able to give you a nice contour of the chest. And this is really patient dependent. If you tend to have looser skin or thinner skin, the contraction from the minimally invasive procedure may not be adequate enough to give you a flat chest. In these cases, either we'll have to excise out the skin or cut out the loose skin, or if it's just a little bit, we can use a combination of other modalities such as skin tightening lasers to be able to at least contract the skin a little bit so that it's a little bit flatter than just the initial procedure alone. Okay. Now for grade 4, so grade 4 is really tough to do, and it doesn't have to be even gynecomastia, but it can be seen in men who have lost a significant amount of weight, so it's like loose skin. So think of this as a breast lift in a male patient. So unfortunately, yes, it does require bigger scars, visible scars, unfortunately, but it does provide a better contour to chest as long as you accept that there will be visible scars. And obviously there are tattoos and options that you can do to kind of decorate the chest area if you don't want people kind of nosing around or asking questions. Now, in terms of recovery, so we can do the stage 1s and 2s, which is the liposuction and the gland excision. We can do that under local anesthesia if you're someone who doesn't mind being awake for, like, let's say, dental procedures. You do require numbing of the chest, which is local anesthesia. And so after the numbing up process, you don't feel anything and you're able to kind of just go home afterwards. Now, if the concept of being awake for a procedure like this just kind of creeps you out, then you do have the option of going to sleep where you wake up and everything is done, right? So obviously there are additional risks with general anesthesia alone, but definitely it's helpful for patients who do feel a little anxious, or if you just don't want to know anything that's going on, general anesthesia is the option for you. The more invasive the surgery is, you're going to have more downtime. But if we do the lesser invasive modality with the liposuction and the gland excision, I do say no exercise for 3 weeks, okay? You can walk as much as you want, but anything that requires weight-bearing exercises or like lifting or chest flies, bench presses, all of that stuff, you're gonna hold off for 3 weeks. Okay. Now for the big incisions, right? So the big incisions for like the stage 4s or the grade 4s or potentially grade 3s, I do say take about a month off just because your scar is bigger and we are removing some tissue. So you're gonna kind of just take it easy for about 4 weeks. Okay. Now, other things to consider after surgery, and I kind of touched upon that before. If there was the gynecomastia was caused by a certain type of medication, it is advised to be able to come off that medication so it doesn't potentially stimulate the gland tissue to come back. And obviously, if it was for anabolic steroids, that is a big no-no. And a lot of the times my bodybuilder guys, they have a little trouble kind of getting this to their head because of the gains that they get. But I always have to warn them that it is and it will come back. Okay, so be very aware of that. Now, other things in preparation for surgery, nicotine users, whether you're vaping, you're smoking, or even using marijuana products that have like nicotine in the product, absolute no. Okay, and this is for 4 weeks before and 4 weeks after surgery, because what happens with nicotine is that nicotine impairs healing. It doesn't allow the scars to heal nicely. You have a higher risk for infection, and you also have a higher risk for what's called vascular necrosis or ischemia, or aka nipple death. We don't like dead nipples, okay? So we really do strongly advise that you stop all nicotine products before surgery to have the best results, because I don't want to deal with a dead nipple. Other things for the recovery period is that I do have my patients wear some type of compression garment, and the compression garment could be like a man bra or a bro, right? But you do have to wear a compression garment for 3 to 4 weeks depending on how much work we're doing. And for this, it really does help with the healing process to kind of keep the swelling, because you are going to have swelling after the surgery, and to kind of keep the area nice and tight. And after the surgical tape is removed from surgery, I do recommend utilizing a silicone scar tape on your incisions. And I do recommend this for all my surgical patients, to use the tape to really improve the appearance of the scars and let them heal as nicely as possible. How long does it take for everything to heal? Right? So for the lesser invasive approach, the final result can be seen up to about 6 to 8 weeks. Now, for the bigger surgery with the bigger cuts and the bigger incisions, it can potentially take about 9 months to a year to fully heal. Now, you'll definitely get an improvement right away. So if you are thinking of the timeline of when to schedule surgery with the summer coming, I would say give yourself at least about a month to be able to be ready, because once the bruising goes away, and usually most bruising will resolve in about 2 to 3 weeks, most people won't know that you had surgery. But you and I will both know that you are not at the final place yet, and you still have that full healing time, and it's again 6 to 8 months versus 9 to 12 months to be at your final place. So I hope you guys have a better understanding of gynecomastia and surgeries and how to prepare for surgery. If you like these videos, you can follow our channel. I like doing these little educational talks because I think it's super important for patients to kind of get like a little course on it. But catch you next time. Bye.